Welcome to Your Health. I'm Dr. Richard Usatine, a family physician. Our guest today is Dr. Edward Sheldon, Director of Integrative Health Services in Santa Monica. Dr. Sheldon specializes in the area of behavioral medicine and psychology. Dr. Sheldon, what is the relationship between stress and health?
Well, basically, the body to be healthy needs to be running as a smooth running entity, both physically, emotionally, psychologically. And the more smoothly the body is running, the more everything is working properly. When a person experiences stress, their body goes into heightened arousal. Sometimes in great stress, it goes into overdrive, a great state of readiness, and sometimes readiness includes muscle tension and tightening. And when the muscles tighten, then you begin having problems because it's blocking the energy in the body.
Well, what are the areas that cause stress in our lives at this time?
Well, there are a lot of different stressors. Some of the stressors are environmental. It could be the foods that one is eating. Sometimes a person might have an allergy to dairy products or wheat products and get a headache. It might be the smog. It might be stress at work. It might be internal stress of feeling low self-esteem. It might be worrying about the future. Any number of different things can create stress that can come either from external sources or internal sources of one's own thoughts and feelings.
Now, everyone responds to stress differently. What are the typical responses that people have to stress?
Well, everybody has things that are more stressful and less stressful. What might stress you might stress me less, and vice versa. So it really is an individualized thing, and it has a lot to do with conditioning. If you grew up in a family, for instance, where you would appreciate this as a physician, if a patient comes to you who grew up in a family where going to the doctor was a positive thing, that you're taking care of your health, then going to the doctor is not a stressful experience. If somebody grew up in a family in which going to the doctor meant calamity, what's the matter, and how are we going to pay for it, and what's wrong with you that you got sick and it's your fault, and then going to the doctor would be very stressful. In fact, not only would it be stressful, but a person who grew up from that kind of environment would be less likely to go to a doctor and then have problems with their health.
I frequently see people in my practice that have tension headaches or stomach problems, and I've often noted that someone who has frequent stomach pains in response to stress frequently has someone in their family, like a mother or father, who also had that. And I also noticed that with tension headaches. Is that been your experience as well?
Well, it's interesting. The reason why that can be the case is that families use communication. And you'll find in health and in illness that metaphors take a very important role. People who can't stomach their work are more likely to have stomach problems, and people whose boss is a pain in the neck are more likely to go to a chiropractor, etc., etc. And so if you grew up in a family in which the communication was, oh, I just can't stomach this anymore, then the child hears this and learns also to make a connection between psychological or emotional discomfort and the physical feeling in the stomach. Sometimes if a person grows up in a very dysfunctional family, they can't even identify when they're hungry or not because there aren't appropriate connections and metaphors between psychological states and physiological states.
Well, okay, so people do get tension headaches, they get stomach pains when something is bothering them. What other ways does the body respond to stress?
Well, an example would be, there's a lot in the media now of herpes, for instance, which is a very devastating thing for many, many people. In fact, just yesterday, one of my patients told me that she's never told anybody but 2 people in her life that she has herpes. She's a 35-year-old woman, and she has not had an intimate relationship in the last 4 years when she found out that she has herpes and she decided she's never going to get married. And that's it. Her life is sort of completely changed, which is not a very appropriate response to having a medical condition, especially something like herpes, which is stress-related. And a person can learn to reduce their stress and reduce outbreaks, or reduce migraine headaches, or whatever it is. So sometimes another example using herpes as an example is that some people who have stress in relationships or stress with intimacy, or feel that their spouse is demanding too much of them sexually, might utilize on an unconscious level creating a physiological problem, whether it be a headache, as everybody knows, you know, the old adage, not tonight, honey, I have a headache. that this is what's called secondary gains, that at times a physiological problem can have a benefit in the system, in the family system or at work. It can, for instance, a person might use a headache to be able to get out of a responsibility in the home or at work, or a person might utilize cramps or a bad back to elicit help from a spouse or from a friend and get attention that they wouldn't normally get. So there are many reasons why people, unfortunately, even if somebody's problem started out simply physiologically, let's say they actually slipped and had an accident and hurt their back, if they start learning that now they're getting all kinds of attention that they never had before, they're less likely to have as fast a recovery if they didn't have benefits from this. And you find if you work with patients who have workers' comp cases that the pain diminishes very quickly after the case is settled.
Yeah, well, actually it's very interesting when you look at people's recovery from back injuries. If the back injury was off the job, it's a certain period of time. If it was on the job, it tends to be 2 to 3 times greater, the amount of recovery, just based on the fact that it was workers' comp.
Right.
Now, that also implies that some people might be purposely using an injury or a symptom to get something they want, but frequently this is not purposeful and it's something that's subconscious. Can you explain that?
I would say that probably 98% of the time it is not purposeful because people don't operate that way. But I think that most of what people do is unconscious. Most people don't realize, for instance, you're not thinking about whether your legs are crossed right now, and I'm not thinking about where the position of my left hand is now. Most of our behaviors are unconscious, and our conditioning is unconscious. So it's not, this is also very important for people in the audience to realize that if you're being referred for behavioral medicine, if you're being referred for looking at what the situation is of the illness to you on a personal level, it doesn't mean that you're a bad person. It doesn't mean that you have a psychological disorder. It means that sometimes there are things that you can do to help in your own healing that you're not even aware of.
Yeah, I find people sometimes are very resistant to accepting that their psychological or emotional state has anything to do with their physical health. For example, someone will come to me for a headache and not tell me that their husband may be drinking and they can't pay their rent and that there are problems with the children. And when I ask about things like this and make that connection between the headaches and those problems, sometimes there is that resistance. How do you convince people that there is that connection between the mind and the body?
Well, I would first say that at first it would be better not to try to convince anybody, because if somebody doesn't want to accept something, there's a very good reason for it. And the reason is that responsibility is a very difficult thing for people to deal with. When you tell somebody that they're responsible for when they have headaches, then you're telling them that you're responsible if their marriage is working, if they're getting along with their children. And you see that there's havoc in the schools today because parents have basically said to the schools that it's the school's job to teach ethics and morals. You know, people have a very difficult time taking personal responsibility for their own space. And if you say to somebody, you know, it's interesting, it's that way in the culture. People are given sick days, and they're not given health days. So the payoff is to get sick. So somebody will get sick so they can take off a day of work. It would be better if they could just say, I'm going to the beach today, and not need to get sick. So in a certain way, what you're saying is if you're trying to get somebody to do something about it, first they have to be comfortable with the idea of responsibility. The biggest difficulty that people have about taking responsibility is they then feel guilty for their entire life beforehand. They said, you mean last year when I had this problem, what happened 5 years ago, you mean I could have done something about that? And it's very important to give people permission to be very self-accepting. Not only permission, but encouragement to be very self-accepting, to relate to the body in a loving way, to be forgiving of the self. Because if somebody's back goes out and they're angry at their back because they're not able to go skiing or they're not able to play tennis, and then they get angry at the back, what's wrong with you? Why can't you get better? And they create an adversarial position with their body, then of course it creates tension. And it creates physical tension, and it's more difficult to heal. If a person can accept himself or herself where they're at right now and say, well, I've always done my best, and I come from parents and grandparents, and they're this in society, and I had this teacher in 5th grade, and I feel the way I do about myself, and to start in a place of self-love and self-acceptance, not a place of narcissism and just me, 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 but in a place of realistic self-love and self-acceptance. And to say, what can I do with my body? Not that my body is a machine. How can I get it to go beyond what's even healthy? You know, how can I run a million miles in a day without ever running out? It's not appropriate. It's not healthy. But how can I get my body to perform well in a partnership and take that kind of responsibility? Then the person can actually have a sense of increased self-esteem and feeling good, because they're able to have their body respond for them and with them, and stop having the tension and the pain. The other thing that's very important is that when you identify what the secondary gain is, if a person's headache, for instance, is a way that they deal with keeping distance or avoiding conflict, if you teach that person how to deal with conflict, they don't need to have the headache anymore.
Now, earlier we did a tape of a biofeedback demonstration, and the purpose of that was to be able to show the connection between the mind and the body. Can you comment on that?
Yes, it's very, very important for the viewers to know that what you think, even words that are said in your environment, actually affect the physiological processes in your body. That a particular word, everybody who is watching this show knows that there's a certain word or a certain thought that will make you sick to your stomach. There's a certain thought that will put a smile on your face. And it's very important to be aware of what your cues are, of what your reinforcements are, what are the stimuli that will evoke something positive in you and something negative in you. If you have something that's in your environment that creates a negative response inside, then you need to learn to recognize it and then decondition the response so that you no longer have to have a negative response. Similarly, it's important to program yourself in terms of positive responses, that you can tell yourself, if you're at the job and your boss is critical, there's something you can tell yourself or think about that will give you a good feeling about yourself, so that you are more in control over your own feelings rather than just being reactive rather than responsive to whatever's happening in the environment.
So should we show that segment?
Yes, let's take a look at this now.
That would be great.
One of the important things that we do at Integrative Health Services is we teach people how to recognize signs in their own body and how to gain a sense of mastery over their own responses. Oftentimes, in fact, most of our patients are referred to us by their primary physician for a medical problem. And most people are not aware of just how much their mental state, their mindset, and their emotions affect their physical health. Here we're going to have a short demonstration with a gentleman by the name of Elliot, who I just met this morning at the studio. It's his first day here at work, as a matter of fact, and I've asked him to do a demonstration for us so that we can show you just how easy it is to use biofeedback equipment to learn about yourself and to gain mastery over your own responses. Here is a machine that gives you auditory feedback. You can hear the sound. It gives you visual feedback so you can see how you're doing. And it measures basic anxiety levels in the body by being connected to two fingers, measuring skin conductance having to do with physiological responses in the cells of the body, in the sweat glands. You'll see that a sudden sound, a sudden potential environmental threatening environment will create a heightened sense of stress. If I went to just touch him anywhere, I'm invading his own personal space, and you'll see also a heightened response. Now, he will say, well, okay, here I am doing something physical, but is it really true that just thoughts can affect our bodies physically? And so what we're going to do is just say a couple of words to Elliot and see how he responds on a physical level just to the thought, just to the idea of the words. Being that it's his first day at work, I'm sure that he might be concerned about, before I say what it is that I think he's concerned about, there was an elevation in the stress level, because I don't need to give an analytic interpretation. He knows inside himself what he's stressed about. And so if he can just ask himself what he was thinking when his stress level went up, then he will gain some insight, and he can learn how to decondition that response by simultaneously doing a relaxation exercise while having a stressful thought.
Dr. Sheldon, would you like to comment on the insert that we just viewed?
Yes, the insert was just done immediately before we started doing the show with a total stranger, and the nice thing to be aware of here is that a person who has no previous experience in biofeedback training can just be hooked up immediately without long-term therapy and to see right there and then what their responsiveness is, what are their stressors. And sometimes a person can go to conventional psychoanalysis and really never get in touch with that, or maybe they'll get in touch with it way, way down the line, and they won't make the connection of what's going on physically in their body. It's really very important, and that's why we call the center Integrative Health Services, to really integrate what's going on mentally, emotionally, physically, spiritually, sexually, what's really going on inside the self. The nice thing is that a person can go inside himself or herself and learn about their own being. And in today's culture, things are, on the one hand, very narcissistic, and on the other hand, very outer directed. And there's very little time for people to just sit quietly and go inside and take a look at what's going on inside, and to be able to have the confidence. And it's a wonderful thing when people come in, and a lot of the patients that we see have gone to 20 different doctors, and very often the patients who are referred to us, I just got a call, for instance, a couple of months ago by a rectal surgeon who sent a patient to us who had a problem for 14 years and said, "Dr. Sheldon, I really don't know what to do with this patient." And we utilized hypnosis, medical hypnosis, and biofeedback. I do a lot of medical hypnosis as well. And in 7 weeks, this person did not have the problem, was off of the medication. She was taking Senecot for 14 years, would only be able to alleviate herself in the bathroom maybe once every 2 weeks or 3 weeks, so she would get very distended and then have pain and bleeding. After 7 weeks of treatment, she was completely off of her medication, not having the problem. And unfortunately, just 2 weeks ago, she was hit by a car crossing a crosswalk, and I saw her in Cedars, and she was already proficient in the use of self-hypnosis and biofeedback, and so we utilized it there to stop the pain, to reduce the swelling and increase blood flow to her leg. And so it's a very nice thing for people to, in terms of increasing their self-esteem, to realize that they don't have to be totally dependent on outside sources for healing. That most physicians will admit that patients who have a positive attitude certainly respond a lot better to treatment than patients who don't.
So someone who is in labor, for example, can use breathing techniques or forms of self-hypnosis to control the pain that they feel in labor rather than using medications. Is that a...
That's true. In fact, research that I did in 1983 shows that what makes Lamaze and Bradley and various childbirth methods work is really hypnotic techniques that are embedded in the training, that people learn to dissociate and to go into an altered state of consciousness and not need the medication. Not only that, of course there is time and place for using medication. There's no question about that. At the same time, medication certainly is not the preference, because certainly most medications have some kind of side effect and sometimes are addicting. A patient once came to see me specifically to get off of a Valium addiction. And she was successful at doing that. She then, in the middle of treatment, we were doing psychotherapy and marriage counseling as well, because there were dynamics in the family that had to do with her addiction. And she got off of the Valium and off of, she used to take like laxatives 12 times a day and all kinds of pills. And she got off of all the pills. And then she went to an internist for a stomach upset, and immediately he gave her a Valium. And it's very important. Of course, the doctor was meaning well. There's no question about it. Unfortunately, in most medical schools, they don't teach that a person can really alleviate pain or actually stop bleeding in a dental chair using hypnosis, that you can literally stop blood from coming out of your gums during a dental procedure, that you can literally stop pain during dental surgery for people who, for instance, may be allergic to chemoanesthesia. Another example is premature labor. The 2 medications on the market for premature labor that are currently used create tachycardia, which is an increased heartbeat, which is not healthy for the mother and the baby. We have successfully used medical hypnosis to reduce premature labor and get people not to need so much medication. And very interesting, because there's a combination of straight physiology that we're working on and also the psychological aspects. On the physiological level, you can use hypnosis and biofeedback to actually tell a muscle to stop spasming or contracting. You can actually tell your brain to tell your muscle to relax. And it's more direct than any medication. You're just going straight and telling the brain, this is what I want you to do. At the same time, you'll find that dreams, recurrent dreams at night, can be connected to premature contractions during a woman's sleep. And you can go in and change the dream cycle and affect the contraction. So very often you're working with a combination of physiological and psychological issues. The example that I used before with a woman who was having their problem for 14 years, in addition to needing to learn how to, and literally another problem that she had was called the paradoxical contraction, so that when she needed to relieve herself, her piping folded over itself and created difficulty in passing. Now, we used hypnosis and visualization to actually get the brain to condition the body to relax at that point. At the same time, there were psychological factors and family factors, that she was the operator in communications for her whole family, and that she would have to hold in what everybody would tell her. You know, it's like their families like this. Sometimes someone says, the mother says, I have to tell you about your brother so-and-so, but don't tell him I told you. And then the sister comes, let me tell you about so-and-so, but don't let me tell you. So the person's stuck with all this, you know what, and there's the metaphor, and then they're holding in on a metaphoric level, and the metaphoric level also affects the physiology. So it's very, very important to understand what's going on. Another example is we had a patient years ago who had recurrent headaches. And he went, I'm not going to mention where he went for treatment, but he went for treatment for years to a pain clinic. And after just a couple of sessions, my colleague had asked him, do you take caffeine? And the patient said yes. And we took the patient off of caffeine and the headaches went away. And that was the end of referrals that we ever got from this particular place, because it didn't make them look particularly good. But the reality is that it's important for the medical community to work together. It's important for doctors and psychologists and nutritionists to be able to see what the other hand is doing, so that you can alleviate problems more quickly for the patient, and everybody comes out better that way.
I agree with you. I think one of the things we want to say to our audience is that not everyone who has headaches can be cured by stopping caffeine.
That's true.
That worked well for this person, and,
That's right.
and it may not work for someone else. The other thing is that someone who is in premature labor, that the first thing that needs to be done medically is to stop that labor with a medication, because the danger of the baby being born too early is far greater than the possible side effect of the medicine, which in fact is actually quite safe. Now, if later on in the pregnancy the person can learn self-hypnosis and get off the medicine, I agree with you, that would be very beneficial, but I don't think we want to say that the medicine doesn't have a role, and in fact may have a role in order to control something initially before a person can learn the behavioral technique, which isn't learned overnight.
Right, and I agree with you 100%. Not only that, there's a very big problem, particularly in California, where holistic medicine is such a big idea. Because unfortunately, most people who call themselves holistic, that's why I don't use the word holistic in my center, even though in a certain way we are holistic, because most people who use the word holistic are not holistic. They're anti-medicine. And the reality is that can be very, very dangerous. If somebody comes to me and they're having headaches, I want them to have a neurological checkup, because I'm not going to have somebody do imagery if, God forbid, they have a tumor in their brain.
Yes.
And it's very, very important also that the audience be aware that what I'm saying is that not that you should lay a guilt trip on yourself that you're 100% responsible for your problems. I am not saying that whatsoever. I'm saying that you can learn to be a partner in the healing. Because sometimes people blame themselves, so they say, well, I just got hit by a car, how did I create this reality for myself? And I'm not suggesting that you do that. I'm suggesting that whatever reality you're faced with at the moment, that you utilize as many as your own resources internally, as well as one good internal resource is to know who's the right medical specialist to call to have you checked out. Mm-hmm. And that's also important, to know how to ask a doctor for help. So I'm very clearly saying that it's important to integrate all different kinds of medicine, and to be able to be a partner and not just give the responsibility to a doctor and say, here, you solve the problem, but that really the patient has to be part of the healing alliance.
Now, how do you actually make use of hypnosis and biofeedback in the treatment of someone who has a problem that comes to you for help?
The kind of hypnosis that we do is very different than 90% of hypnosis done in the field. Most hypnosis is direct suggestion. The hypnotist induces a state of hypnosis and says, you will do this, you won't do that. And we really don't work that way, because I am in the philosophy that the patient needs to learn responsibility and how to help himself or herself. So the way we use hypnosis is we help the patient to find out what the causes of their problem. We use idiomotor signaling, in which the brain responds in a nonverbal movement of fingers as to whether there is a psychological component or not. If the brain tells us that there is a psychological component, we look for it, and the unconscious mind will reveal what it is. If the brain tells us that there is not a psychological component involved, then we let it be treated simply by physical medicine. The important thing is to be able to have the patient learn how to use hypnotic abilities, which everybody has, to be able to find out inside. In fact, not only do people tell you in hypnosis what the cause of the problem is, but they will often tell you on an unconscious level what they need to do to solve the problem, which is very beautiful, because very often doctors are searching for the answer. And sometimes the patient really knows what they need for their own healing. And what you might want to do, those of you who are viewing the show, is just to take a moment and to take a deep breath, to notice how you're breathing. Are you breathing just in a shallow way, or are you really taking air into your body? See how your muscles are. Are your legs crossed? Are you holding in your neck? And just see how much love and relaxation you can give your body, and feel how much better you can feel when you pay attention to yourself. As I say to our patients, if you pay attention to yourself, you won't have to have tension. Better to pay attention than to have tension.
One thing I'd like to say is that people use the word psychosomatic a lot, and they use it in such a way as to say that it's all in their head, or people make this assumption that because it's psychological, it's in their head. I think it's very important for people to understand that something that might be made worse by their emotions or their psyche isn't not real. That it's
That's
still
correct.
real pain.
That's correct.
It's still real upset. It's still real headache, real stomach ache. And knowing that the psychological forces do impact on the body, one can pay attention to both,
Right.
treat both, and realize that there is that mind-body connection. We're out of time. Thank you very much for being here with us today, and join us again next week. I'm Dr. Richard Usatine, and thank you for watching.